I'm Andrea Cancelli. I'm the scientific director of GMD, producer of Plexer in Italy, Rome. And I thanks very much the organization for the kind invitation to this high-level meeting. Thank you very much. Well, today I would like to present the innovation, or better, the revolution of Plexer in aesthetic medicine, dermatology, and so on. I will go through physics, clinics, and engineering, so I hope you can follow me. Otherwise, please come, ask. I thank Aphrodite that invited me also, so please come to the stand, ask me everything you need. I want you go out to this place confident on the technique, on the efficiency and safety of the technique. Why revolution? Revolution, yeah, because you can switch a lot of devices you are using actually in your office with Plexer, and a revolution because the 60%, I can assure you, the 60% of your patients will ask about Plexer. We have a lot of KOLs all around the world, and their agenda is full of 60-70% on Plexer appointments. Well, introduce myself a little bit. I'm a clinical engineer. I got a bachelor in clinical engineering, then master in biomedical engineer. Then I went to New York City to run a PhD in neuroscience. After that, I decided to come back in Italy and work for the National Council of Research. Then from basic research, I switched on company research and development. And now, as I said, I am the scientific director and quality assurance of GMD. Together, I teach at the University of Rome about certifications and quality assurance. That's why I'm here, actually. Well, soft surgery. I don't know if the translation is perfect. This is why this is how we call it in English. Soft surgery because it is a new concept, a concept that GMD tried to spread out, to point out the real purpose that you have to reach for your patients: results, safety, and less discomfort than possible. This is why soft surgery. Not bleeding, no knife, no minimal downtime. Plexer, plasma exeresis, is actually the top device for soft surgery. I'll try to go into physics now. Plasma. First of all, I heard presentation on PRP, and so maybe plasma can be confused with it. Plasma for blood is something, this is plasma, the first state of matter, like solid, liquid, gas, and plasma. The physical phenomenon that everybody of you know about plasma is lightning. How it works. Matter, you know, is composed by atoms. I say just basically in a way that you can follow me. Atoms together create molecules. Each ball, for example, is an atom. All together, they are molecules. Well, molecules interact each other with different forces. If the interaction is really high, you have a solid. A solid can maintain shape and volume. This is how you can macroscopically see a solid, unless a big force came to break it. But it can maintain volume and shape. Liquid, less interaction among molecules. Liquid can maintain the volume. 1 liter of water is 1 liter of water. If you pour down the water, you have 1 liter of water, but something that maybe someone can be upset to if you have the water on the pavement. So the shape can be maintained. Gas, they do not maintain shape, volume neither, because they occupy all the space they have. And then there's plasma, first state of matter. Interaction is even less between molecules. Each molecule is split in positive and negative part. Altogether they are neutral, no current. But this is a ionized gas. Ionized gas, it's how it's called. So molecule positive and negative. So, lightning can do this. A lot of energy comes between clouds and the earth. If the energy is enough, you can ionize the air between clouds and earth, and you get lightning, you ionize the air. Air is not a conductive material, so you can create plasma with no conductive material. You need a gas with not high conduction like air. If you have energy enough, you ionize. For example, is 3000 for the air, 3000 volts per millimeter. You can ionize that kind of that piece of air. So 3000 per millimeter, that millimeter you get ionized, electron is kicked out from the atom. All together, if you have the energy, in this case 10 power of 9 is 1 billion of volt between clouds and earth, you have the lightning. Another example to make clear the phenomenon, the TP, plasma TP, everybody knows. Yeah, same. From here to here, 2 layers, there is a gas in between, a pixel, red, green, and blue, and the micro lightning is created on the color that I need. That's why we need a lot of pixels for a TV. More pixels, more definition, because each pixel is one of color. This is the principle of plasma TV. So we need a dielectric material between the two parts in the game. And this is what happened with Plexer. Plexer creates plasma ionizing air between the point, the tip of the device, and the skin of the patient. If you touch the tip, nothing happens. I don't have the air to be ionized. If you are too distant, nothing happens. The technique is pretty safe. I can do mistake, I cannot. But what is the difference with lightning? Lightning maybe is dangerous. Yeah, no, it is dangerous because it has a lot of energy, a lot of power, 1 billion of volt. This is not the case. With Plexer we have control, and it's the only device to do the control. I don't know if you had the appetizers of workshop with our KOL Alina, Dr. Alina, outside. Later we will have another at 5 p.m. and another tomorrow at 2 p.m. So you can see. If you don't use the right energy, it is not so safe. Okay, so we put a microprocessor on the tip of the device, emitting the right quantity of plasma necessary for treatment. That's why it works only on the skin. If you try on the wood, on the other kind of material, it can't work. You control the power. Why? We put 3 pieces in the device because the usability is the more important thing. Doctor need to be confident on the technique. Okay, 3 pieces, 3 different power, a lot of different treatments that you can run. Temporal control. Why? You need the right timing, but it's much more simple than using laser. Spatial, it's your expertise. You will do that after a while. It's pretty easy. And we know with the microprocessor, all the ionized molecules between the tip and the skin. So, let's go to the important part. We created this plasma, the necessary plasma. What happens to the skin? The skin, where plasma acts directly, or better, just the epidermis, the top of the epidermis, are immediately sublimated. Sublimated, what is sublimation? I know you know, is the physical step from solid to gas. We avoid liquid. Why? Because we need some energy from the epidermis, we need some energy to the dermis, and we do that with conductive heat. No irradiation like laser, no light, no current like radiofrequency or electrocoagulator. just conduction of it. So if we pass to liquid, there is a lot of time to pass all this heat. We need microseconds. So before cornocytes or the top of the epidermis sublimates, the right quantity of it goes down. This is what happened. Well, we sublimate top of the epidermis. Immediately, we have the contraction of the collagen because the conductive heat stimulation. And after a while, because of the stimulation of the fibroblast, we'll have new collagen remodeling. There are a paper talking about collagen type 3. We are studying that. This is a good hint to start, obviously. So, plasma doesn't act directly on the dermis like current, like radiofrequency, like electrocoagulator, like other kind of plasma, I don't know. Just on epidermis. The basal lamina between epidermis and dermis is preserved. Some histological results from Dr. Sotiris. Well, on the left you have the before treatment, so you can have the papilla, dermis papilla, the epidermis and the dermis. After a spot with plexer, the less invasive, let's say, because the power of plexer is that you can decide what you want to do. You want to be superficial, you are superficial. You want to go deep for xanthelasma, for example. I heard a fantastic presentation before with a Q-switched laser used for xanthelasma. Yes, I mean, it's a little bit complicated. Now I need to use Q-switched, they're not... No, the doctor is really good and she's brave. But I think that if she tries to use plexer, next year she will have a presentation on plexer. I'm pretty confident of that. So you can decide what you want to do, superficial or not. This is for example, a spot for blepharoplasty. I want to be superficial, I don't want to be invasive. And this is the spot. You sublimate the superficial part, you don't go on the basal lamina directly, but there is the stimulation of its conduction because you can see the collagen immediately retracted after as one spot. This after 30 days. What happened? What happened to the collagen? Let's see. Dark. We are in the dermis now. No vessels are distinguishable. Fiber. Brightening here and here. More dense. This is a published scientific paper. The material that I will show you is all published on journals indexed on PubMed. I'm not talking about nothing. And if you come to the stand later, we can show you we can discuss. I can show you new papers, scientific papers, new protocols, videos, whatever. Well, 30 days after, also here, the yellow is the collagen remodeled after one spot. Okay, what we can do now? We do this. We have this remodeling. We have this contraction of collagen. What we can do a lot. I'm almost embarrassed when I talk about plexer doing so much, but that's true. And we are now with a scientific approach showing evidence by evidence all the applications. We have 5, 6 now. I'll show you. Aesthetic medicine, of course, lifting, wrinkles, removals, because I can be ablative if I want. Why not? Gynecology, labioplastic and vaginal rejuvenation. Dentistry, whitening of the gingiva and gummy smile, so it's a bit aesthetic also. Dermatology, of course. A lot. You can do a lot. Just with one device, not mixing. I know that mixing technology is the best, but really try to do plexer. Well, this is how plexer started out. Now we are diffused all over the world, and I'm pretty happy that we are spreading also here in Ukraine. Yeah. The gold standard is blepharoplasty. It is known all over the world. I admit that. But I'm pushing a little bit to also point out all the dermatologic and gynecologic things that plasma can do, Plexer can do. Differences between why Plexer became so famous. This is on the left, I think, blepharoplasty, with surgical blepharoplasty. Discomfort for patient, sure. Knife, bleeding, sewing on the skin, downtime, very long, risky, asymmetry, scars, if the doctor is not pretty good. Plexer, no bleeding, efficient, easy to perform, this is the point, and most of all, safety. This is 1 week later surgical blepharoplasty and 1 week after Plexer blepharoplasty. This is a scientific paper again, Dr. Sotiris. And then I show some results. Lentigo solaris. This is 1 session, not so many sessions. Downtime, 5 days, maybe. Some crust you can cover with some skin cover, that's it. Procedure, 30 seconds for the doctor. Blepharoplasty. It is different. If you need to do a removal, like a lentigo, you go with the spray technique. I mean, you spray and you remove. Then we will go through the technique later, maybe, if you want. For blepharoplasty, for elastic retraction, you do spots. But you are like the painter. You decide where you want to go. It's not like a laser. You try CO2 and switch, okay, but you are related to the device. You are not, it's operator dependent, but it's pretty safe. You cannot do scar or keloids, or the percentage of hyperpigmentation is minimal, and we have remedy. This is blepharoplasty, of course. This is a barcode. Like I say, you don't need to go random. I saw there is a wrinkle here. So I push these vectors. I work on the vector to lift the eye. Here, this is the optimal case to run blepharoplasty with Plexer, blepharochalasis. It's a lot. And you can see the country where picture come from, just because you can see that we are approved all over the world. This is a lifting. You can believe me, 1 session. I think this 2 or 3. Perioral. I think we can to discuss on the results. And we go where I want to go, the xanthelasma, so that maybe you talked about some doctors talking about the risks on use laser on xanthelasma, what kind of laser, multiple lasers. You can do this in one session. Vaginal rejuvenation is labioplastic. You go again spot with Plexer, and you get the retraction. This is immediately after. This is how the patient go home. Little bit of redness. Then it will become a scar. Scabs cross little bit, 5 days, 6 days, and that's it. We are experimenting a lot. So this is the case when I confirm Q-switched is better, beta 2. But you can work also on this if you have Plexer in your office. It's not the gold standard, but you can do that. The results are good. Scars, great. Maybe scars created by a laser. You can solve. You get the retraction. Dentistry. It's dentistry, but also aesthetic. You get the removals. You can do this with laser. Yeah, you can do that. More downtime, maybe more painful, probably. 10 minutes works. Gingival whitening. You go spray with plexer and you will have a new tissue. I have the scientific approach. I'm not commercial, so I'd like to tell you, that's why I'm here, all the side effects that you can go through. But the important thing is that you keep in mind they are all temporary. This is a scientific publication on dermatologic surgery. 10 people running blepharoplasty. Phototype from 1 to 3. This is the average. 4 to 7 days for cross. Depends, of course, on the skin of the patient. You will be able to study the skin of the patient. 2 days of edema, and maybe, in the worst case, 30 days of some redness. Hyperpigmentation, minimal. In this study, no one developed hyperpigmentation. It's pretty difficult to develop hyperpigmentation because we are superficial. So, we are in a laser meeting. Why not to talk about differences? Laser against plexer. You know laser maybe better than me, but we know laser is a stimulated light. Light, especially, is coherent, is monochromatic. So the purpose of a laser, it's just one color. I emit that wavelength, I hit that color. That's why you need more lasers in your study, in your procedures to run a complete treatment, because it's monochromatic. Usually, one laser do one thing very good. Then you can apply that for other, but the gold standard of each laser is one thing. This is the deepness of all the lasers that you can reach. So I can use a diode laser. I can do a lot of things, not very well, maybe some vascular. I can use CO2 for ablation, but the difference is that laser, it's from inside the skin. Light interact with the chromophore, that's why we are aiming to, for example, red. When the light go through this red, it starts to diffuse heat. So it's like warming up from the inside. Principle of plexer is different. It acts from the outside. I sublimate the superficial cells, and then the heat comes down with conduction, not interaction, not current, not not light, not heat source inside the skin, from the outside. So, some minus. Good lasers are expensive, and they can do again one thing. Downtime. You can develop more easily hyperpigmentation. Downtime is longer. Less versatility. Also, your pictures, eyeglasses, protection, no mirrors. The doctor should be careful. You need a lot of practice before starting. This is what with plexer you don't need. Let's go to radio frequencies. Differences. Radio frequency is currents generated with 1 million of oscillation per second. Why? Because I need to go inside. So I need also oscillation to overcome the epidermis. But using high frequencies, I am much more aggressive. So if I use an electrocoagulator, the risk of scar is high, hyperpigmentation, sure. And same happens if you use not certified devices or different device, because the parameters you generate plasma are more important than the technology itself. I need to perform the right plasma parameters. This is the differences with radio frequency is 100 times the frequency that plexer uses and 100 times power compared to plexer. Much more aggressive, much more invasive. You can cut with the radio frequency. That's the principal use. And you have, for all this power that you generate, you need the return electrode. That's why with the electrocoagulator, you need the return electrode. Go current across all the body, diffuse heating. So yeah, much more aggressive. You can create a scar. Yeah. So, also with different devices, you need the right parameters, right testing, right publication showing the parameters are right. Voltage, right voltage. Frequency, right frequency. Deep emission is very important too, because if you change the needle, you change the emission. So this is what we tested with plexer. And this is what you need to create a physical, stable phenomenon. Because if you create a plasma trembling, it's like you are surgical, treating the patient with a knife trembling. I wouldn't do that. This phenomenon needs to be stable. Right components, again, right parameters. We don't want to give the electroshock to the patients. We don't want to hit the tissue so much for repigmentation and downtime longer. This is what happens if you use different parameters generating plasma. If you use an higher frequency, you are much more aggressive on that point, and you can create the cut. You need to cut, so you are much more aggressive. If you use less frequency, the plasma beam starts from being too much far. So you are not precise, much more, you go deeper. So it can be more painful for the patient. Different voltages. If you use too much voltage, you go deep too much again. So downtime, pain, and so on. But if you use, I heard about devices saying, we are much more superficial. Yeah, you don't get the result. You need to go to the right deepness. You don't need to go to superficial. You need to go to the right deepness. And this is what Plexer showed in scientific publication. This is anesthesiologic with Plexer, the inflammation after one spot again, and after another device. You can see the inflammation below. These some journals. I didn't show you. I wanted to show you all the journals we published it on. Just come on Aphrodite stand and ask for them. These are our certificates of quality. If you buy a device, please ask the certificate. I am the quality assurance of GNV, so I am quite proud to show you them. But please, for your safety and the safety of patients, watch out that this is a medical device what you are buying. ISO certificate means general production and managing of the company, complying the European law, and the CE certificate. That means the device is a medical device. Don't buy whatever they propose you. And this, obviously, we are pleased to come to Ukraine and show the certifications. All the certifications. Then I want to close. This is all the Ministry of Health all around the world that approved us extra-European, because obviously we are in Europe, and this is, but we are getting the approval everywhere. We are closing with the FDA also. But you can already see, on visa for Brazil, very difficult. KFDA, Korea, Australia, all the states. So it's really that ask, where the device can be sold? Ask the agent when they come to your study, to medical office. So thank you very much. Спасибо большое. And thank you for listening.